Welcome to my podcast. Today I'm going to talk about another common case. So basically, after you introduce yourself, as always, you agreed, double check the patient name and date of birth, you'll find a child being escorted by his parent. And the mama will say, oh, doctor, my child is unwell, not feeling well. I thought he has flu, but obviously it's still ongoing, and I don't know what's wrong with my child. So you'll tell her, okay, can you tell me more about it? So she will say that the child was unwell for the last 10 days. He has a sore throat, he's not eating, he's not drinking. All the time he's saying, I'm having ache in my throat. And also noticeably, he's feverish, and he's coughing, he's sneezing. And additionally, for the last 2 days, he started to complain from his tummy. He's saying he's having tummy pain and he can't walk properly. He says his knees is hurting, or maybe the hips. And he's just all of a sudden developed this rash overnight. And I don't know what's going on. When you ask her about the rash, you say the rash is not hurting, and when I press it, it's not blanchable, and just spots everywhere in his body, mostly in the lower limb, buttock, abdomen, joints, and I don't know what's going on. So you'll ask her, okay, do you have any thoughts or ideas what might be the reason for his rash? She say, well, he had just a flu, maybe he caught a bug from the school or the nursery, and that's his situation for the time being. You will ask her then, what about his, his delivery? Was it normal vaginal delivery? Is he up to date with his vaccination? And is there any other alignment that he might have? Any past medical history for the last 7 years, if known? So she will tell you, no, he was normally delivered, he's up to date, he's developing okay with the red book and the milestone, and he never had any issue before. And I will ask her if there is any other sibling, for instance, or if there is any family history with the same issue. And then she will tell you if she has other sibling or he's the only child, and if there is family history or not. You will ask her then, proceeding forwards, if there is any medication history, and if there is any known allergy, and what does he do usually, and how's getting along with the school, with his peers, and this kind of thing. When you're taking the history from the mother, you need to think about some differential. So basically, you will ask if he has any problem, as I say, since birth, or if there is anything that seems to be just recently. And in that concept, you'll start to build up your differential. And also ask her if there is any other associated symptom apart from what she mentioned so far. So with this history in mind, you will think about, firstly, meningococcal infection, so meningitis. So you'll ask her, does he get irritated with the light? Does he vomit? Does he has any neck stiffness or cry from moving his neck? Also, if there is any history of kidney issue, if he has any kidney issue after the history of the infection, upper respiratory tract infection. And the other common thing that's seen in childhood, which is called vasculitis of childhood, is Henick-Schlein purpura. Because it has a distinctive rash distribution in the body, including a buttock, lower limb, and sometimes around the abdomen as well. So you will tell her, okay, I would like to have a quick look on the child and examine him. So if the child is crying, try to calm the child, or maybe examine while his mom beside him. So the characteristic of the rash, as I mentioned, it's not tender, and it's rounded all over the buttock and lower limb. and it's when you press on it, it does not blanch, so that's characteristic. Other thing, if you are thinking of like leukemia, for instance, because it's common in child, meningitis, as I mentioned, autoimmune nephritis, if there is any kidney symptom, and other were purpura you would think of as immune thrombocytopenic purpura. So basically, we understand that she said that he has abdominal pain, so this could be related to the GIT vasculitis, and she said she has a knee and hip pain, and he's not able to walk, arthralgia, so it's all related. And if there is any symptom of kidney, that's another thing which can be involved in just kind of vasculitis. So you will arrange for basically some blood test and also urine analysis, and ask if there is, and try to examine the child. Is he conscious, oriented, not drowsy, in order to understand if the central nerve system has been involved or if there is any abrupt mental state change. So you'll ask the mom how he's doing, how he's reacting, is anything doesn't seem right from his norm. And also if he's, for instance, in rare situation, they might have orchitis, so if there's any testicular pain or lung symptom, which could be related to vasculitis in the form of pulmonary hemorrhage. So if the case is mild, it's usually treated in the community, and they do well, just symptomatic relief in the form of paracetamol or short course of non-steroidal anti-inflammatory drug if the kidney is not involved, of course. However, if the case is severe and you did your observation, you find that the patient has fever, he's not responding, he's drowsy, his blood pressure is high, you did the urine analysis, you find, or microscopically, you can see the hematuria or micro, and if there is any abdominal pain, testicular pain, urological symptom, all of that, you need to admit straight away and arrange for that. And of course, you'll treat initially with pain relief. However, if it doesn't work, you will arrange for steroids, and then you will take it from there. And those kind of cases, they have to have like a follow-up regularly, at least checking the blood pressure, urine analysis for at least 12 months. However, in certain cases, sadly, sometimes around 30%, they can relapse even up to 10 years after the initial presentation. So, assumably, the case was mild, and you send mom away in the community with the treatment, just telling her to keep an eye and notice if there is anything that doesn't improve or doesn't within a few weeks' time, and the child is not recovering. Tell her she needs to come to bring the child immediately or take them to the A&E. However, as I mentioned here, the child is unwell, feverish, complaining of abdominal pain and joint pain, so preferably sent to the hospital, and also he has high blood pressure, to be admitted and treated in the hospital, and keep an eye with the regular checkup, and once discharged and doing well, regular follow-up for 1 year time. So I hope by that I covered one of the most common vasculitis in childhood, and I see you on another podcast. Thank you.